When I joined neurosurgery in the year 1994, I trained one of the two best neurosurgeons in India at that time, Dr. A.S. Hegde and Dr. Venkatramana. They are my gurus. We learned so much from them. And I started seeing patients. That's when I actually connected to the ground of what's happening and then started seeing surgeries. An IT professional's father who had a brain hemorrhage on the right side, of the brain, and he had left-sided stroke, and he was semi-conscious. The clot was not big enough to operate, so we were trying to dissolve with the medicines, and he was initially in the ICU and then came to the ward, and I was the doctor in charge of the ward. So, when patients are there for a long time, weeks together or months together, you get familiar with the caregivers, they become like your friend. I was a junior guy. So one day that IT guy came and asked me, the son came and asked me, why don't you do a scan to see what's happening? Why he asked that question was, normally we learn from our seniors that if you don't operate on the clot, it dissolves in 8 to 12 weeks. So that's what we used to parrot to those families. So, and he asked me that question, then I asked my chief, I said, what do you think? He said, okay, get a scan done. And then I went and got a CT scan done. And for my good luck, the clot had dissolved, significantly. And as a small neurosurgeon in training, you feel that you have done something about it. So I was so excited about it. I went and told him, listen boss, the clot is dissolved, very triumphantly. And he asked me a very straight next question, then why is my father not talking? Why is he not walking? And that hit me like a truck. I said, what is he saying? And that moment, what I got in my brain is that physical healing is not equal to functional outcome. So I realized that just operating and saving somebody's life is not good enough. It may be good enough for me, but not good enough for the family. Number two. Number three was a young businessman, just 6 months married, his wife was 3 months pregnant. He had a bad head injury. He had a clot on the left side of the brain. And just for your information, left side of the brain controls right side of the body. Left side of the brain also controls the speech areas. So he had a lot of clots, and there are two speech areas. One is for understanding, other one is for speaking. And both areas of the blood clot, my senior surgeon went and operated him. And beautiful post-op scan, pre-operative scan, clot, post-operative scan, no clot. That means operation successful. And then this guy eventually came out of ICU, ventilator, consciousness, and eventually walked out of the house. One day he came back for a follow-up, and I saw him. This man is walking around, but he has zero speech. Either he's understanding what anything anybody is saying, nor is he able to speak. He does not even respond to his own name. So if his wife calls him up by name, Suresh, he doesn't turn back. She has to physically go hold him by the collar and bring him back. He's not recognizing his children, his child that was born. He's not recognizing the wife. I said, what have you done? We have given this family an animal. Because what distinguishes animals from human beings is communication. And with this guy's communication is gone, what's the point? That's where we got stuck. When I saw this, I realized that just surgery and saving patients' life is not enough. Like how Krishna told Arjuna in Mahabharata, to fight is your duty. And number one, and number two, you fight to win, not fight to just hang around. That's what it is. So I tell everybody, listen, I'm an eternal optimist, I fight to win. We do the best we can. Eventually, it's his destiny that's going to happen. So that's the next thing that had to happen, that we had to make sure we deliver the right kind of rehabilitation. And neuro rehab consists of physiotherapy, occupational therapy, speech therapy, language therapy, swallow therapy, memory therapy, cognitive therapy, behavioral therapy, and pain therapy.
In neurosurgery, what we do is to prevent death, but life is given by a rehabilitation person, a person who can get you back on track with all the problems that a person has faced after a trauma or after any injury or tumor. Coming back to life will be done by a rehab person.
Because neurorehabilitation is actually a part, it's an integral part of the neurosurgery. With neurosurgery, especially for the functional neurosurgical part, movement disorders, dystonias, Parkinson's, which actually affect a significant proportion of the population, including the psychosurgery, which also falls into this category. So the surgery becomes a primary step for treating these patients. But surgery in itself is not sufficient for the complete management of these patients. For them, you need to rewire their brain, you need to relearn, and you need to unlearn some of the wrong activities, for which the neurorehabilitation is a very important part.
So any patient who has a head injury will have some neurological deficits or disabilities. that cannot be corrected completely with a neurosurgeon or surgeon by itself. That has to be done by neurorehabilitation. So, in complete care of head injury or stroke, and the neurorehabilitation plays a very vital role and very important role.
In any surgery for that matter, not functional neurosurgery alone, spine surgery you take, or you take a tumor surgery, whatever, you take any surgery, rehabilitation is extremely important. And rehabilitation means from the psycho rehabilitation, from to physical rehabilitation, to occupational rehabilitation, to functional rehabilitation. So rehabilitation is a neglected portion. And now awareness is coming that 50 to 60% you can do something. The remaining percentage, more improvement or maximize the benefit of what you have done, rehabilitation comes into play.
My name is Praveen Nambiar. I based out of Trivandrum in Kerala and 45-year-old. Have a family with 2 kids. Elder daughter is 16-year-old, son is 11-year-old. In fact, it was a car accident, as I remember. I was told that okay, I had met with an accident, and the police called the family, and the family rushed. And from Bowring, initially police took me to Bowring, and then I was taken to Mahavir Jain Hospital to get a better treatment of Dr. Sharan. So my cousin actually took initiative of that, and then eventually that's what happened. And yeah, further to the accident, I really don't remember, or even I didn't know exactly. Till this time, my family told me exactly what really happened during that space. And then, yeah, now I'm aware that okay, this is what happened. Of course, I was told that okay, I recognized my family members as my office colleagues. In fact, my daughter was recognized as my new joinee within my team, and she's a trainee, so on and so forth. At that time, even though she was kid, I could not recognize her as a daughter or a kid to me. It was my new joinee at that time. And later on, it took 3 to 6 months time for me to come back to the normalcy aspect on the perspective of my family that yeah, I am recouping right now. But till then, I was confident what I am saying. Only the perspective of others could not get gelled, probably got cognizant enough to be the reality, meet the reality. Even though I don't remember, I was told that okay, I could not recognize myself or anybody within the family as my wife or kids or mother, brother, so on and so forth. And it was very tough for them to digest the condition in which I responded, not just from ICU to the wards scenario. Even then, I could not communicate. I could not say properly, talk properly. I should not tell them, and forget about all these things. It is about me doing something of my own, right? I should brush. I should be doing X, Y, Z, changing the clothes, using the right clothes, so on and so forth was not happening. And I was told that okay, I had the support of speech therapist, physiotherapist, cognitive therapist, occupational therapist to come and guide me and practice me.
So to explain what neuro rehab is all about, one is neuropsychology, because anything to do with neuro is to connect with the brain primarily, and brain circuits and the spinal cord. So to do with neuropsychology or neuropsychological assessment and retraining, cognitive retraining is all about to do with higher mental functions. So when I say higher mental functions, it could be decision making, it could be attention span, it could be memory circuits, it could be problem solving. All these things come under behavior, all these things come under neuropsychology, okay. The second thing which is important one is occupational therapy. Occupational therapy is to do with the hands, upper limb basically. So when patients have a hemiparesis, we call it hemiparesis, stroke in simple words. So right side or the left side is paralyzed. So if it is especially right sided paralysis, the right hand, most of the people are right hand dominant. So there are lot of work, daily living work happens with the right hand, like whether it is brushing your teeth, combing your hair, wearing your dress, buttoning, eating food, all those things. So these are fine motor skills which is done with the fingers, right? And there are gross motor skills like which is joint movement, like lifting your hand up or bending, any of these things, flexion, extension, these things. So, and the other thing the occupational therapists do is ADL, activities of daily living, meaning to say me being independent on my own, not depending on for my personal work on anybody else. That is what is ideal. So if I'm able to do starting from morning, to get up in the morning, go to the washroom, use the washroom, brush my teeth, comb my hair, dress myself up, and I'm able to have bath and come out and eat my own food, I'm independent. Maybe I'm not going out to work, but at least independent inside of my house and not taking anybody else's support to do these activities. That is activities of daily living. Okay, that is the occupational therapist's job.
There's a big role by the speech pathologists here. We start with their tolerance. So there's something called as a deflation, deflation, blocking. There are different steps as to how we take out the tracheostomy. So we do that, timed deflation trials, timed blocking trials, so that we can remove the tracheostomy out faster, and also, but it has to be safe. We don't make a hurry and remove it just because we have to get it out. We don't do that. So we make sure that it is safe for the patient, and then we do it. That is one perspective. Then another thing is, post stroke, there are people who've got speech clarity issues. It's called dysarthria. So in such patients also we give different oromotor. You might see, like if you see the patient, there's a weakness on one side of the face, there's a drooping of the lips, weakness of the tongue. So such things also we work on. Then language perspective. So post stroke, post head injury, you see a lot of patients with language issues. They don't understand what you're saying, they're not able to follow commands, they're not able to give you eye contact, they're not able to name things, they're not able to repeat. So some people may not be this severe, but some people, so different kinds of aphasias are there, where there are conditions where they don't understand what you're saying, but they'll just keep speaking random irrelevant speech. So there also we work on them. There is also when they understand everything, but they're not able to speak. So such conditions also we help them to speak. Some people, everything will be normal, but they just won't be able to name things. So those patients also we work on. So Nina, you said today is 22nd, no? Yeah. So which day is it? Tuesday. Okay, correct. It is Tuesday. So now I want you to look at this board and tell me which day will be tomorrow. Today is Tuesday. Tomorrow is Wednesday. And yesterday was? ठीक है. Yesterday was? Monday. Awesome. Nina, can you take and show me pink color? Thank you. Can you take and show me green color?
ओके क्लासरूम में 6 बच्चे बैठे हैं.
फ्रंट रो में बैठे हुए बच्चे क्या कर रहे हैं?
एक बच्चा पढ़ाई कर रहा है और दो बच्चे बातें कर रहे हैं.
टेबल के ऊपर क्या है?
टेबल के ऊपर किताबें हैं.
I came to Bhagwan Mahavir Jain Hospital on 10th August for neurorehab. I am like this now because of my therapist.
Hi.
Good morning.
Good morning.
Okay, I'll ask you a few questions, okay? Okay. So, Neena ji, tell me, what is your daughter's name?
Roshi.
What's your son's name?
Nishan. Vishal.
Okay. What's your new baby's name?
Theo.
Okay. What's your husband's name?
Sanjeev.
संजीव. आप क्या बुलाते हो उनको?
Guddu.
गुड्डू. ओके. आपका नाम?
Amy.
What is your name?
That's me.
Yeah, what's your name?
Diana.
Your name's Diana.
Nina.
Nina. What's my name?
Shreya.
Sneha.
Sneha.
Okay. Okay, tell me, what's your sister's name? ಈ ಥರ ಹೇಳ್ತೀರಾ ನೋಡಿ ನನ್ನ? ಪಾ 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 ಈ ಥರ? ಓಕೆ. ಈಗ ಟಾ 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 ಹೇಳಿ. Slowly. Where's your spray? Yes, yes. Try. Try it again. Try to touch your spray. Lift your hand. Yes. Good, good, good. Touch it. Touch your spray. Good.
Chinna. Murder.
Channa.
Chinna. Chinna. Murder. Murder. Chinna. Murder. Chinna. Chinna.
Heart beats fast, colors and promises. How to be brave? How can I love when I'm afraid to fall? But watching you stand alone, all of my doubt suddenly goes away somehow. One step closer. I have died every day waiting for you. Darling, don't be afraid. I have loved you for 1,000 years. I love you for 1,000 Time stands still, beauty and all she is. I will be brave, I will not let anything take away what's standing in front of me. Every breath, every hour has come to this. One step closer. I have died every day waiting for you. Darling, don't be afraid. I have loved you for 1,000 years. I love you for 1,000 more. And all along I believed I would find you. Time has brought your heart to me. I have loved you for 1,000 years. I love you for 1,000
Basically, in the world of rehabilitation, always equate to physiotherapy. So this is where it starts usually. So even the people, the doctors, the moment they put rehabilitation, it is physiotherapy. So physiotherapy is an integral part of the rehabilitation, but it is not the rehabilitation. It is an important aspect. As a physiotherapist, we are trained to take care of the bodily functions primarily, how well you can move, how well you can feel the sensations, how well you can walk around. This is what usually a physiotherapist does, like the bodily functions and it's the movement control. This is what the physiotherapist world about. In the neurorehabilitation, it is one piece of the puzzle. It's a big piece of the puzzle, but it is just one piece of the whole puzzle. There are other problems like their thinking problem, their cognitive problems. They can have issues with their vision. They can have communication deficits. As a physiotherapist, I cannot do much intervention for that. But for a complete patient recovery, each one of this is important as much as physiotherapy is important. So this is what basically physiotherapists usually we work on.
Pain is another big entity which adds up, because a lot of people, when they come to us a little later, they have a frozen shoulder because the hand is not moved, for example, for a very long time. So the frozen shoulder creates a lot of pain. So that pain has to be released. So there are pain therapists who release this kind of pain. It could be pain because of the postures, because there is a paresis on one side, they start using the body in a compromised situation. So there are a lot of muscles anywhere in the body which can get into spastic method. So that has to be released. The tightness has to be released. So the pain therapists do a lot of these releases for our patients, and that actually benefits in the outcome. So this is the whole everything together which makes neurorehabilitation.
Functional neurosurgery, as the name implies, where the surgery is performed to improve the functional status of the patient. Patient, for example, what Sharan does is movement disorder surgery. So there patients have uncontrolled movements of the hands and legs. Even simple things like drinking from a glass of water or a bottle of water may become a Herculean task. So to improve these functions, surgery is performed, and that is one aspect of functional neurosurgery. The second aspect of functional neurosurgery is epilepsy. Uncontrolled epilepsy is very dangerous. As you can see, they can have a lot of injuries, even death from epilepsy. Children will have learning disabilities. Women may face divorce because of their epilepsy. Men may find employment very difficult. So all of these issues can happen to anyone who has chronic epilepsy. So if we are able to ameliorate that with medicines, it's very good. But a proportion of patients will require surgery to control their epilepsy. Such patients again undergo functional neurosurgery. It is done to improve their function.
Imagine somebody's had a stroke and the weakness of the right hand, and this hand improves with physiotherapy and he is moving well, or with occupational therapy or rehabilitation, it is moving well. Now in front of him is 3 cups of coffee. One is in a steel cup, one is in a thermocol cup, and one is in a glass cup, assume. Now if he follows the thermocol plan for the glass cup, he will drop the glass. If he uses the steel plan for the thermocol, he will squeeze it. Now the question is, who decides the plan? Is it the hand, is it the eye, or is it the brain? So it's a brain, eye, hand coordination. It is real time going based on the smoke, based on this, you decide how to hold it. How does, just by filling in more brain cells doesn't mean anything. The day we are born, we had the same number of brain cells. But that brain cells has nothing. It's like buying a brand new computer with no data inside, no software inside, no windows inside. Think about it. What will you do with that computer? It's useless. It may be the best computer in the world. It just doesn't make any sense. So unless you put the right programs that you want, the right apps that you want, the right features that you want, then you can use it to benefit you. And you want this computer to benefit you functionally, not just keep on looking at every day, putting it on and saying, that's not what you want. You want it to send a message, you want to send an email, you want to watch a movie, you want to do so many different things, and those requirements are different for different people. So that thing should be functional enough to deliver what you want those features to deliver. The same thing here. This patient wants these functions to be delivered by his nervous system so that he can interact with the environment outside. And that has got impacted because some circuit in the nervous system has got damaged or injured or whatever you call it. Now, there is no scan in this world to tell me whether this damage is permanent or temporary. Is reversible, irreversible. Do you know that? It's not available. So how the hell do we know? And if I don't know, how can I predict it to my patient? Now today it's all like Brahma's business, all shooting in the dark. We won't have a method in the madness. So we have to make sure that this happens. So functional neuroscience is the core of the future, not structural neuroscience. And functional neuroscience can only be delivered by a combination of neuromodulation with advanced neurorehabilitation. There's no one organization in India today which is delivering it end to end. I'm proud to say that PRS Neurosciences is probably the first and only company which is delivering quality neurorehabilitation at affordable cost, right from the ICU, second day on ventilator patients, all the way to a resort. At different stages, it's like a child going through nursery to primary school to middle school to high school to college. We are holding the family's hands all along. The families have no clue what is to be done. They need help, they need direction. When we talk to them, they said, "Doctor, you are the first people who told us all these things. We didn't know what was going on." So that's when we felt that we had to establish this a whole comprehensive, affordable system that can hold somebody's hand from end to end.
The way PRS Neurosciences started and the way I have interacted with PRS Neurosciences is, I should say very clearly that it was Dr. Sharan's dream baby, right? As a neurosurgeon, he was trying to service patients completely, and he found that, you know, rehab was a place where he was, as a neurosurgeon, he was doing his part of the surgeries, but then functionally getting them better on their feet into the community was not happening. So that was the call that he had, that, you know, he had to do something more for his patients, and that is how he enrolled me into it, and that is how my journey with PRS Neurosciences started.
नत्वहं कामये राज्यं न स्वर्ग्यं न पुनर्भवं कामये दुःखतप्तानां प्राणिनाम अर्तिनाशनम. Ayurveda says that a person should become self-dependent, and also he should become self-independent also. He should have a particular level of independence so that he himself can manage and also manage others. Ayurveda speaks about fundamentals about life. As you say that Ayurveda means Ayu means life and Veda means the knowledge about life. So when we speak about life in Ayurveda, it means more of functional entities.